Hey guys, this is Dr. Colin Zhu, and thank you so much for being here with us on the Thrive Bites podcast. This is season 4, and we're so excited for you to be here. For those of you who don't know me, my name is Dr. Colin Zhu, double boarded in family and lifestyle medicine, and I interview the best and most passionate health and wellness experts of the industry on this platform. And we talk about plant-powered living, emotional resilience, and creating a thriving mindset. And this season, we're taking it live, we're taking it on multiple platforms, and we're taking it as a Q&A discussion as well as our interviewing of our guests. So we're super stoked about this, and please remember to like and subscribe down below, and we will see you. Welcome to the next episode. All right. Well, welcome everyone to the Thrive Bites podcast. I'm your host, Dr. Colin Zhu, and thank you so much for being here with us. You can be anywhere in the world, and I am really appreciative of the fact that you spent just a few moments to spend with us. Today's episode is excellent. I think it's a topic that we can all relate to, and that's how to get the best possible sleep. And I have a fantastic guest for you guys today. I'm going to share a short bio. His name is Dr. Dave Shirazi, and basically he graduated from Howard University College of Dentistry in Washington, D.C. He went on to earn his master's degree in Oriental Medicine from SAMRA University in 2006. In 2007, he received a prestigious fellowship award from the American Academy of Craniofacial Pain, an organization dedicated to the diagnosis and treatment of craniofacial pain and sleep breathing disorders. In addition, he's also completed over 2,000 hours of continuing education in TMD, which is temporomandibular disorders and facial pain, craniomandibular orthopedics, and sleep disordered breathing. He lectures on these very subjects himself throughout the United States. And additionally, he fulfilled a hospital mini residency in Oriental Medicine at the China Beijing International Acupuncture Training Center, the only institution authorized to teach globally on acupuncture and herbology by the World Health Organization. So he has a lot more accolades, and we can spend all episode talking about it. So without further ado, please welcome Dr. Dave. Hello.
Yeah, hi Doc. How you doing?
I'm doing well. Thank you so much. I really appreciate you being with us here on the show. How are you doing today?
Having a great day. We're living our best life here in LA, as you know.
That's excellent. That's excellent. Yeah, we can't definitely got to be appreciative of the things that we do have. You know what I'm saying? So, so I find your story and your background very, very interesting. The topic for today is really about how to get the best possible sleep. And it's something that all human beings, everyone on the face of the planet can relate to, right? And I think on this podcast, we talk about, the big health pillars, of life. We talk a lot about food. We talk a lot about relationships. We talk a lot about building our emotional resilience and creating a thriving mindset. Sleep is one of those really underestimated, under-talked, under-discussed,
underappreciated.
Definitely underappreciated topic. And
for sure.
So I definitely, always, have an opportunity when I can, whenever I have a sleep expert, to be able to invite and kind of talk more about it. So it becomes more in our forefront. So with you have so many different interesting and unique perspectives on sleep. And so, that's why I love, going into this session with you, this episode. So let's take us to the beginning for those of us in the audience who don't know your background. What was the inspiration, for you to go into, number one, dentistry, and then also eventually transitioning to, Oriental medicine, and then ultimately focusing on, things in the head and neck, and then, sleep disorders?
Thank you. Well, it's pretty straightforward, actually. My mom is a dentist, and I was very excited. My first job was at 14, being a dental assistant, watching her do dentistry, doing a root canal. And I love working with my hands. I love helping and talking to people. So to me, it went really well. And one of the, my whole family is like doctors and dentists essentially. And one of the things I didn't like about traditional medicine, to be a doctor, was, sometimes your patients can die on you. And that was something that didn't really appeal to me. I like just being able to do things in a functional way that helps people. And so after dental school, I decided to study, Chinese medicine, the first school that, has been accredited in the US, excellent training. And they facilitated me doing the hospital residencies in China and Korea. And honestly, it sounds bad, but I'm just going to say I did all of it for selfish reasons. Like, it feels good to help people in dentistry. It felt good. I was studying Chinese medicine so that when I have my own family, I could use it as a platform in which I could take care of them. That was my number one goal in studying it. I actually wasn't going to finish the master's. I actually wasn't going to sit for the board exam. I just wanted the knowledge for me. And while I was studying and while I was practicing, I was still working full time. I was treating pain and treating sleep and doing what's called functional orthodontics. And one of the many stories I had was I would make these oral appliances to treat their TMJ problem. And patients would come back and tell me, doc, my migraines are gone. And I thought, well, good for you. I didn't even know you had migraines. They said, no. When I take my appliance out, my migraines come back. And I thought, okay, I didn't think anything of it. And literally, I think it was a month later, a different patient presented the exact same way. So I thought, okay, well, maybe this isn't a coincidence. So I started to ask my mentors, I started to ask my educators, and they actually talked about the relationship between the TMJ, tension type headaches, and migraine type headaches, and how, I don't know if you've probably heard the term central sensitization goes, how a migraine can be a centrally sensitized TMJ disorder, potentially. Not the only reason, but potentially. So I started treating more and more patients like that. And I started incorporating the acupuncture into it and the, herbs. And, it was so gratifying. It was so pleasurable to help these people get out of pain that they've been in for years. Because the traditional medicines, as you know, for migraine are abortives, which, don't really cure the migraine. They kind of just delay it a bit. So to actually do something that was very, very helpful in either reducing greatly the number of migraines per year or even eliminating them altogether was, to me, much more gratifying, right? And then so I kind of went into it on the pain side first. That still excites me very much. And then I learned that one of the reasons why people clench their teeth at night is because of a form of sleep apnea called upper airway resistance syndrome. Right. So then I wanted to go and study about sleep. And unfortunately, in the sleep world at the time, I've been doing this for 20 years. At the time, there was very poor training in dental sleep medicine. It was mostly, here's an appliance and this is how you sell it. Right. And so then I went to the medical training, and the medical training side was usually CPAP driven and medication driven, which is neither of which interest me to do on a daily basis. So I found this whole world of sleep technology, where a sleep technologist is the person that they conduct a sleep study, an overnight in-lab sleep study. And I loved it. These people are amazing. They work the night shift, so they're shift workers, which is challenging in its own right. And they have to monitor 20 streams of data and make on-the-fly decisions for the patient if they're doing a titration. So these people are amazing, but they're so much more practically oriented. They're, okay, here's what we do in this situation. Here's what we do in that situation. And I loved it. And I became one. And I was a sleep technologist for 5 years. And I opened up my own sleep lab, which I still use for research. And when I realized that sleep apnea could be behind the TMJ problem, and we could potentially prevent a TMJ problem by addressing their sleep apnea, that was a whole new paradigm for me, which I really loved. And now my focus is on sleep as well as TMD and ortho. And it sounds clickbaity to say it, but I wholeheartedly believe this, and I have the evidence to support this. Getting a good night's sleep is more important than diet and exercise, right? And predominantly, to make it in as simple a way as I could say it, we have 4 stages in our sleep, but 2 stages in particular, delta and REM, are incredibly important for human survival. Delta is where we get almost 100% of our growth hormone, right? And 1 stage of sleep. And then REM is when we do our mental, emotional consolidation, our emotional processing. And we're even finding out, we know so little about it. We're just finding out, like about 5 years ago, that the brain has its own lymphatic system. And during REM, it processes out the beta amyloid plaques, right? So there's a huge amount of benefit in getting a good night's sleep. And the sleep breathing part becomes relevant because if you're snoring or you're having apneic events, it can kick you out of those deeper stages of sleep. And the reduction in those good, healthy sleep cycles, we call them arousals, when you get kicked out from a deep stage to a light stage, can cause nearly any inflammatory disease that you can think of, right? So the reason we can use the word sleep apnea can cause hypertension, can cause type 2 diabetes, and etc., is because when we find patients that have both type 2 diabetes and sleep apnea, when the literature shows when we resolve the sleep apnea with either oral appliance therapy, which is what I do, or CPAP therapy, which is traditional therapy, their type 2 diabetes either goes away entirely or is significantly reduced. Same thing with hypertension. We see hypertension either going away or is greatly reduced. Now, clinically, I know you're a clinician, for hypertension, there could be obviously many causes, but if you have a hypertensive patient that is on 1 or 2 or more, diuretics or just any kind of calcium channel blocker or anything, and you're just barely reeling it in, right? They're like 140/90 with the medication, right? That to me clinically is the hallmark for someone that has sleep apnea, because you're not really addressing it with the medication because there's another autonomic stimulus happening at night that just carries it over.
Yeah, super interesting. Especially it's in terms of the earlier days when you transitioned into your professional career as a sleep technologist. So I guess a follow-up question based off of that is, why do you think the technology or these functional / practical applications were not developed sooner? Is it because no one was paying attention? Or is it because like the technology, the equipment, the ingredients or components, I don't know the correct vocabulary, wasn't, I guess, up to snuff,
no,
during that time?
No, it's really more the fact of one, technologists need to, like, doctors do not like to be called in the middle of the night with a technologist, that has a problem they don't know how to resolve. The technologist really needs to figure out what's going on and solve it on their own. So it's kind of like the knowledge, begets the necessity, right? And technologists, unfortunately, by and large, are not educators. They're not even technically treaters. A technologist, for example, is not allowed after a sleep study to tell in the morning to tell the patient, by the way, we diagnose sleep apnea. Okay, and you should talk to your doctor, right? They're not allowed to say that. They have to wait for the physician to have the conversation with them. Yeah. So they don't get that much patient, interaction in the context of this is what you should do and this is what we found and etc. They have to wait for the physician to order a titration study with CPAP or something else, and then they do that. Also very practically. But they're not in a place to have a conversation to tell the public, hey, listen, you know what? If you're having these health issues, maybe you should consider doing a sleep study, and maybe you should see if you have sleep apnea and treat that. So, for example, like one of the things I love that you talked about was you talked about how your podcast is about mental resilience, right? Mental health is number 1 in my book. That's number 1. Okay. And there's been a number of really large studies that talked about the impact of sleep apnea on both depression and anxiety. If anyone wants to do the research on it, you would search psychosocial disorders and sleep apnea. But one study, one of my favorite studies, it was published in JAMA. They tested over 1,400 patients with PSG, and they gave them, and they were aged between 30 and 60,
Mm-hmm.
and they gave them what's called the Zung's depression scale, where they write down how depressed they are. You know, ranging from I have sad thoughts once a day, or to I consider suicide on a daily basis, like that, the range, right? And then they did sleep studies on them. And of these, I mean, 1,400 is a pretty large study for what this is. And what they found was the relationship with the severity of their sleep apnea and the severity of their depression was 1-to-1. Meaning the more depressed they were, the more severe their sleep apnea was, right? And we also know sleep apnea is typically very progressive. So if you, for example, if you're in your 20s,
was there a reverse relationship, like a reflexive relationship to that?
So exactly. So it was both, like the mild all the way up to the severe. And then in follow-up studies, they've done studies to measure the improvements in psychosocial issues with CPAP or oral appliance therapy. We have I don't know if it's in the thousands, but the last time I checked, we're in the hundreds of studies that support that. So it's a huge part of it.
Yeah, that's very, very interesting because like we said, a little bit off camera a little bit, it is something that's not really utilized or underappreciated, understudied, and I'm really glad that you're at least reminding us and reviewing us these studies that have been done. Some of which we have a lot of healthcare providers that watch the show as well. Some of which we probably don't even have a chance because there's so much things in clinical medicine. Depending on what part of the healthcare system you're working at, that we have to pay attention to. And, and I'm glad that, studies are being done all the time, and we're getting better at doing better studies. So, these are great points to highlight. So let's transition a little bit and talk about how do you incorporate, your additional studies of, Chinese medicine into sleep. What was, why, how did that, happen for you? And you said that you come from a family of doctors and dentists. Do you have family members that studied Oriental medicine or traditional Chinese medicine?
No, I don't. And I have family members that were deeply upset and disappointed when I studied Chinese medicine after dental school, which was kind of sad. But then they asked for acupuncture later. It was not, well received by my family, who are very much more to one side when it comes to traditional medicine. I incorporated in my practice for both pain and sleep. For sleep, we have three kinds of insomnia, right? We have primary, secondary, tertiary. Primary, you have difficulty falling asleep, and then you have difficulty staying asleep, and then you wake up early and you can't go back to sleep. That's tertiary insomnia. So in Chinese medicine, we would go even deeper, and we would say, okay, so are you having hot flashes when it's hard to fall asleep? Are you just have excessive racing thoughts? Do you have anxiety, right? And then, do you have indigestion? Do you have acid reflux? We have all these parameters in which we look at it. And then whether we use herbs or we use acupuncture, it's surrounding what the patient is doing with themselves. So it's like, I don't prescribe insomnia medication. I'm a dentist, but I would do acupuncture and I would do some herbal treatment to help them while I'm treating their snoring and sleep apnea with an oral appliance, for example. And I just find that that's something they need. Another thing that could be causing, like, let's say a secondary insomnia could be someone that had what amounts to a PTSD in the middle of the night, right? So sometimes, they'll wake up from a nightmare. Let's say they wake up from a nightmare from 2:31 that was extremely terrifying and scary. The brain really doesn't know, and the limbic system doesn't know the difference between the real world and the dream world, right? So what I see it every year, where someone will have a dream like that, and then they'll wake up at 2:31 every morning,
Mm-hmm.
right? And they have a hard time getting back to sleep, even though they don't have the dream anymore,
Mm-hmm.
right? It's sort of like a mini PTSD. And
Mm.
that's something, we work with cognitive behavioral therapists.
And this is where the mental health piece connects, right?
Absolutely, absolutely. Because if we're not getting good sleep, we're going to have a hard time being able to process anything else that happens in the awake state,
Mm-hmm.
right? I
Mm-hmm.
had a patient I consulted with last week who was on 4 different psychotropic meds for his anxiety.
Mm-hmm.
But then the psychotropic meds, we know, can kick you out of REM and can make you clench your teeth very hard.
Mm-hmm.
So there was an issue with his jaw with pain, and there was an issue with not being able to get a night's restful night's sleep. So that we get into this loop where it's like you're not sleeping well, so you're anxious, and then you take the medication, which then retards your REM sleep, which then retards your ability to recover, and you get into this cycle that just never seems to end. So I value working with the physician and saying, okay, I would like to do a trial of this. Can we work on a pharmaco solution that's like maybe a bit more mild, a bit more reserved while we're doing this, so that we can get the result the patients need. And so far they've been very open to that, both the patient and the psychiatrist.
That's awesome. I like the fact that it sounds like you would be working and collaborating with many different types of specialists, not just their primary, but also,
Absolutely.
Obviously sleep medicine, psychiatry, I think, because at the end of the day, it's all connected, right?
It is connected.
And if we can figure out, how they connect, and once we realize that and where the deficiency is, then we can figure out, how to unblock, right? Because
That's right.
a lot of Chinese medicine is just, chi flow meridians and blockage and having obstruction, right? So
That's right. That's right.
So let's go back to dentistry for a little bit, just to touch on, really quickly. Has anything evolved over time in terms of, you mentioned, the sleep aspect, of dentistry, right?
Mm-hmm.
I didn't even know that was a thing, until you brought it up. Has it changed and evolved over time since you've been in your profession?
Oh, for sure. For sure. It went from being something that no one knew anything about to something that pretty much every dentist talks about. They know of it. And it's something that is being improved upon every day. The processes are not terribly standardized, right? So there's still continuing education that varies. They have techniques and styles that vary. And so having yourself as educated as possible, to me, is the most important thing. So, for example, you talked about how I have this knowledge and collaborate with other people. I collaborate also, in addition to every doctor you mentioned, I collaborate with chiropractors, physical therapists, myofunctional therapists. And my mom, as a dentist, would tell me, she's like, why are you taking this course? You teach. Why are you doing this? Right. And I said, well, I certainly don't know everything. Right. And the more tools we have in our toolbox, the more we're able to say, aha, this tool is the right time to use it. Right. So I can know when the right time is to make that referral. Yeah. And so when it comes to training in dental sleep medicine, it's important to have a broad eclectic training, because not every patient presents the same. Sometimes they'll have nasal obstruction, and even that can vary, right? They can have tonsillar obstruction, they have infropharyngeal problems. And so we as dentists need to know, well, how do I approach this patient? What's first, right? What's second? What's third? And then, not least of which, do they have a jaw problem, right? So the reason why the offices are called the TMJ and Sleep Therapy Center is that if you bother to look, it's very hard to find a TMJ patient that doesn't have a sleep disordered breathing problem. And it's very hard to find a sleep disordered breathing problem patient that doesn't have a TMJ problem, right? And so when this whole sleep world came before us, those of us that were treating TMJ disorders with oral appliances, like this just was perfect for us, because we knew what to do. And more importantly, we knew what not to do. Right. the world of oral-facial pain in dentistry was sort of like the dark corridor at the end of the hall that no one wanted to go to,
Mm.
right?
We're going to go straight to a quick commercial break and we'll be right back.
My dream always had been to be a comedian. I think that laughter is a form of meditation. It's not about fixing ourselves. It's about learning who we are and why we operate the way that we do. And that can foster more self-love, and that can foster more self-care. And that can then turn outward into a life that more accurately and, smoothly fits who you really are.
All right. So let's pick up where we left off. So I think you had mentioned we were going into the evolution of, dental sleep medicine, and how you were talking about the toolbox and how that you have a toolbox. It's like, okay, this is appropriate for this.
Exactly.
We were talking about referrals, and I think that's where we left off.
We did, and I just remember what we were moving into, or what I was moving into, which was that that toolbox became much more relevant when the whole oral appliance world came in for us docs that were treating TMJ with appliances. We knew what to do and what not to do, like where to move the jaw that was safe, and that would give us the airway that we needed, but also protective of the jaw because the patient still might clench while wearing it. So what was interesting that we see now, and it's mixed, of course, is general dentists that are doing sleep apnea appliances in their office will often not have much TMJ training, like on how to manage a jaw problem, but they'll jump to the sleep apnea side. Like, to me, it's like, I feel like if you want to treat sleep apnea with an oral appliance, you need to know what you're doing with the jaw first before you get to that stage. That's my mindset. Right. And because, like I said, it's not that standardized, people are just going general dentistry straight to oral appliance therapy for sleep apnea. And, there can be some challenges as a result of that.
So because of that lack of, I guess, process, do you feel like the different, I don't know if it's the correct word, but detours that you had to make with the Chinese medicine and the sleep technology, technologists and all these other additional trainings, do you feel like that was mostly you had to do that because there was no straight path to it?
That's
correct. You felt like, you kind of had to feel like, oh, this original toolbox doesn't have all the tools that I need. So I actually have to go somewhere else, like a totally different toolbox, and to gather what I needed.
That's exactly right. It's like, it's one of those things where it's like, well, no one else is doing it, so I just better roll up my sleeves and do it myself. And that's how I felt like it's been. And it's great. I mean, I learned a lot of things on the way. I've been able to help my family, help my friends, and of course, help my patients along the way as I learn more and more. It's really great.
Yeah,
it's a lovely
that's
profession.
Awesome. Yeah, no, that's awesome because it's very much needed, and that's I'm glad that you have so many tools, to be able to arm yourself with. Which brings me to my last set of questions is getting into the nitty gritty of basically sleep. Why do you feel like are the top 3 reasons why Americans are not getting enough sleep? And what would you say from your experience and spending so much of your expertise, what would you say would be the top remedies for those top 3? Obviously everyone's a case-by-case scenario, but just like if you can give us from your perspective trends and patterns in terms of Americans, like what are the top 3, and how do we remedy those?
Right. So, a big problem we have now are people, being on their devices at bedtime. And I'm guilty of it too. I look as well. We have something called a circadian rhythm that determines when we fall asleep and when we wake up. And it's made based on our cortisol levels, and that is made based on the amount of light, sunlight, that we get through our eyes. Well, our brains cannot tell the difference between a photon of light from the sun and one from the screen. So, I'm all about, like, when I wear it, I wear very dark blue blocker glasses. I have a screen blocker that's also polarizing on my phone. And then I tell my phone between, I think, 9 p.m. and 6:30 a.m. to go into this low light mode, this dim mode, right? That's a big one. Two, we live in a stressy time right now, with the pandemic. And so people are clenching harder, which then, the number one cause of insomnia is chronic pain. So, the clenching will definitely kick people into like a heightened state of arousal and make deeper sleep much more challenging. And, when you say Americans, we are, per capita, the fattest population, I believe, on earth. England and Australia are catching up, but still we're very overweight, myself included. And with that, we know, like we mentioned, snoring and sleep apnea kicks us out of those restful stages of sleep. So getting your sleep checked and then treated is really important. Even if you feel like your issue is, no, I think I have more insomnia than sleep apnea. Well, if you have both, it's going to be harder to treat the insomnia if you have sleep apnea all throughout the night, right? So having that checked is a big deal. So roughly 90% of people in America that have sleep apnea don't know they have it. They haven't been tested yet. They suspect it, their bed partner suspects it, but they don't have a proper test. And of the 10% or so that is tested, the option they're given, their first line of treatment, is CPAP, right? CPAP works really, really well. However, it has a very poor adherence rate, like something like 50% adherence rate, right? And, a little bit less than that too. Their standards of adherence are,
it's clunky. There's a lot of straps and noises. It's just a very, it's not that fun from my patient's experience.
Yeah. And unfortunately, both sleep technology and general sleep medicine has not evolved to the point of just saying, I have just the sleep dentist to send you to, right? Because even the American Academy of Sleep Medicine says, for mild to moderate cases, oral appliances are fantastic. But for severe cases, obviously CPAP's preferred. But even when CPAP is not tolerated, meaning it's rejected by the patient, oral appliance therapy is preferred over doing nothing at all. Right? We know this, but it's also very challenging to get the kind of medical professionals to say, you need to find, a dental sleep expert that's going to help you with if you can't do CPAP, you got to do an oral appliance, or you can consult with an ENT to see if surgery is an option for you. And then maybe you can get somewhere. Do you know what I mean? It's because that's the other thing. It's like, 90% aren't tested. Okay, well, the 10% that are tested, half of them have given up CPAP, roughly, right? So now we have 95% of the population that has it that are either untested, untreated, or both.
So what would be like if I was an audience member, have no medical training whatsoever, what would be the first, couple things for me to say, like, oh, I should go to my doctor and possibly get, a sleep study? Because for me, my experience to patients is that, okay, maybe, we're addressing your, hypertension, your, your obesity, your diabetes, all these different ways. Definitely one of the things that, I would send them to for a sleep study is if they snore. Some of the times they don't know if they're snoring. Their spouse might complain of it. And it wasn't until actually I had a previous sleep expert that told me that any form of snoring is actually abnormal, which and I was like, I was taken aback. So what would you say in terms of like, okay, when should I visit my primary to get these referrals?
Well, like we talked about, like any inflammatory issue, right? So hypercholesterolemia, hypertension, type 2 diabetes, depression, anxiety, history of heart attack and stroke, Parkinson's. These are things that you bring up to your doctor, or if you're just having poor sleep, right? So usually adult males and postmenopausal women, if they have poor sleep, they don't wake up feeling tired. They feel tired around 2 to 5 o'clock p.m. That's when they're looking for the cup of coffee, the Red Bull, some kind of sugary thing, something to stimulate them because they're starting to fall asleep. Women of childbearing age, typically, if they have sleep apnea, they'll wake up feeling tired. That's just, I'm making generalizations, but that's that's how it is. So, but here's the thing. It's like, you may wake up feeling fine, but if you crash around 5 o'clock, 4 o'clock in the afternoon, that is a symptom you need to tell your doctor about. It's like, listen, I saw this podcast. I did some Google research on myself with my Google doctorate degree, and I'd like to have my sleep tested. And there's two forms of testing. There's an in-lab study, which is very comprehensive, and an in-home study, right? And, if it's sleep apnea is your biggest concern, I'm fine with people getting screened with an in-home study as opposed to an in-lab study, right? If it's insomnia or, REM sleep behavior disorder where you're like dream walking, things like that, you're going to need to do it in a lab so they can get a good EEG on you. But yeah, it's starting off with a home sleep study that's easy to tolerate. It's in your own bed, your own pillow, your own environment. We're going to get a pretty decent representation of what your sleep architecture is like. And then we can go from there and go, wow, okay, well, I've been on this medication for years. I haven't been able to resolve the diabetes, the hypertension, the whatever. And go, let's do a trial of CPAP. Let's do a trial of oral appliance therapy. See what happens. Okay. If I find that my blood pressure is fine now, then maybe I can wean myself off the meds. If I find that my blood pressure is normal in the morning and everything is, my fasting glucose is great, let's wean ourselves off of that as well. So that would be, or if you're just depressed and anxious all the time and you want to know, am I getting good enough sleep? Right. Okay. So, get a sleep study, then talk to your doctor about it. There's no harm. It's one of those tests like if you get a blood test, right? They have to draw your blood, they have to spin it, they have to have a lab process it takes time. A sleep study, and especially an in-lab study, gives us more data than any blood test. And it's just, we're asleep while we're doing it, right?
Yeah, I love the fact that, you mentioned about, I guess what we call food coma, around the 2 o'clock hour after lunch. And, a lot of people, even myself, you just attribute to like, okay, it's a big meal or, something very sugary and we have to go get this pick me up. And I find that to be very enlightening. So to say like, okay, why am I crashing? And not actually realize that, hey, it might be due to poor quality of sleep. And everything related to that. So that's actually a very good point. Last couple of questions is that you mentioned about the oral appliance, so is it not wise to, do it yourself in terms of getting your own mouth guard, or would you recommend actually going to someone to have it customly fit?
Well, obviously a custom fit appliance is going to be superior to anything over the counter. The over-the-counter appliances are designed to be very temporary appliances, right? One of the things I found out about them is, and everyone kind of knows that these over-the-counter ones are very, they disintegrate, right? And then you have to throw them away and you buy a new one and all that. See, the thing is, they don't disintegrate on the shelf at CVS. They disintegrate where it's wet and 98.7 degrees. So that means we're swallowing the plastic. Right. And, in a short term situation, that's not going to cause any problem. It's not going to be that much of a hormone disruption or, cancer causing to the stomach or anything like that. But if we're doing that every day for months and years, now we're looking at a potential problem. Right. They were not designed to be long term treatments. And that's why our appliances are FDA approved long term appliances. They're made of materials that are FDA approved. and they're designed to work to hold the jaw in the right place and keep the airway open. So yeah, I mean, you could say I'm biased. That's what I do for a living.
Definitely.
I make oral appliances.
But the long term, component of it, I didn't consider that, like, you're going to be swallowing that, and if it's not the best ingredients or components for your long term health, it's something to consider.
Yeah, and it's like, for example, I've told people, I go, listen, they're like, listen, I snore like a bear. I'm about to go on a camping trip with my buddies or my family, and they complain about my snoring. What should I do? Well, it's like, well, it's Thursday, so I'm not going to be able to get you an oral appliance in time, but go ahead and pick up one of those appliances, try them out. Don't go too crazy with pulling your jaw forward, because you don't know if you have a jaw problem yet. I've assessed you. And wear it over the weekend so that you can help mitigate the snoring and mitigate, the potential disruption to the rest of the people in the little cabin or tent. So it definitely has a purpose. But as a daily treatment, no, just have a professional make it.
Last question. Melatonin, does it work?
Hi, Doc. Yes, nice to connect with you again. Excellent question about melatonin, because it's very commonly used. Not that many people know the limitations of it, but the therapeutic dose is supposed to be between 0.1 milligrams and up to 3 milligrams a night. And I hear patients telling me how they just take a fistful of 3 milligram tablets and just swallow it, which is what they give for patients with Parkinson's disease. It's too high of a dose. So, and of course, it's not something you want to take on a regular basis. You want to take it as needed, right? Because your body will stop making it on its own, and we need melatonin to make DMT that's in our REM sleep. So it's a very, very well needed molecule to support ourselves with. And it does help with sleep if you're having problems falling asleep, but it's not intended to be taken every day or very, very high doses. So really talk to people like yourself, your physician, so that they can find out what's right for them and how they should take it. I hope that makes sense. So again, it was a real pleasure being on your show. If more people want to learn about the subjects that we discussed, on YouTube, they can find a 1-hour Google Talk that I did. It's really informative. We have a bunch of testimonial videos, and our website, TMJLA and TMJ Conejo, they're both the same website, are chock full of data. So if any of your readers are interested, listeners are interested in coming and having their pain and sleep disorders treated, we'd be delighted to help them out. Be well, and I look forward to doing this again with you soon.
Guys, thank you so much for watching that episode. We hope you enjoy it, and please remember to like and subscribe down below so you can get continuous updates for future episodes and future guests. And we can't wait for this upcoming season, so don't forget to like and subscribe, and we will see you on the next episode.